So one of the experience I had was a lady came in with poor obstetric history. He has had like 2 miscarriages. So we know about her past medical history. So that lady was like an egg to us because we really wanted to see the outcome of the baby and the mother. So we helped her through her 9 months of pregnancy, though she was having difficulties because she ended up having eclampsia. So we were like battling with her throughout the delivery, throughout her journey in pregnancy up to delivery. Because of the eclampsia, we even had to ask her to do cesarean section earlier than the expected date of delivery, just to save the baby and the mother.
Well, like those that are developing pressure, the mothers, the pregnant mothers, some of them, they develop high pressure. Immediately they got pregnant. So they can develop eclampsia. Now, can let the mother said getting drowsy at times when immediately the mother is walking, might got blackouts, then fall down and fits.
Things are improving, but there are cases where the patient has had hardly any antenatal care or has had such sporadic care that the vital windows of time when she should have had the care, or say for example her blood pressure should have been checked, or her urine should have been tested, or blood work should have been done, and those are missed, and these lead to the adverse outcomes.
So that is why when they come with that problem, PIH, pregnancy-induced pressure, so we usually treat them with Aldomet. They are prescribed for. It controls the pressure. We have been referring them to government to take the pressure treatment. But we find out that that medicine now is not just common supply, unless they go and find it to the pharmacy. Then they come and show me, then I see it's the type. Then they will take it also daily, one every day, for the pressure to control.
So preeclampsia, which is also known as gestational hypertension, it's a condition that occurs specifically during pregnancy. Risk factors, though, are women coming in with pre-existing hypertension. That really calls back to that importance of preconception health. So if women are able to have good health before coming into pregnancy, that reduces their risk for getting things like preeclampsia. Preeclampsia, again, is sort of thinking about that increased risk of chronic illness over the life course. And it's also a point where we can think about intervention. So if a woman has preeclampsia, that's really a part, she can really think about sort of making lifestyle changes due to that, because not everything's gloom and doom, right? These are also sensitive and critical periods in which we can intervene as well. And especially if the healthcare provider does a good job of having a conversation with her about what her life might look like after giving birth, that's really important. And in terms of kind of making sure she is having a healthier lifestyle, which will then reduce her risk of getting that hypertension later in life.
Most women, when they go back, family stress, so they tend to have a raised pressure. So they're coming back and we checking their vitals, we know that, oh, this is a baseline, or there is something that is triggering them. So we counsel them and let them know what they have to do right now, what they cannot take, so they'll be at least focused and know how to take care of their health.
Always not to work hard, not to have stress, to drink also water, taking fluids during the day to control it. Then to reduce the salt diet so that they can control the pressure. Also these starchy foods, to reduce them, white rice, fufu, not to take them much, because also they can rise the pressure, starchy foods.
So we did the cesarean session, and I was part of the theater team to receive the baby. Upon receiving that baby, again, imagine with that post-traumatic issues, that baby had nasal flaring. That was the first time I saw a baby with nasal flaring just from the delivery room. So I was so scared. So we had to resuscitate that baby. We set up an oxygen for the baby at least to have some few hours of oxygen. The woman was crying. I said, trust God. We are doing it to see the success of this baby. We want to see this baby live and healthy. So at around 11 p.m., I had to carry that baby to the government hospital. The baby spent like 3 days. I was like close monitoring with that baby. Every day I would be going there up and down to see that baby comes out successful. So luckily, the baby was discharged from the unit and brought back to the mom. The baby was fine and they discharged him. It was this past Sunday that they even named the baby. Guess what? They named the baby after me because they were so much appreciative of how come the baby has reached this peak.
The song is for preeclampsia and danger signs. And the danger signs. Yes. Pressure arrow is up. Pressure is up. Check the woman for preeclampsia. Arrow is up. Pressure is up. Check the woman for preeclampsia. Arrow is down. Pressure is down. Check for bleeding. Sepsis anemia. Arrow is down. Pressure is down. Check for bleeding. Sepsis anemia. Let us all take appropriate action. Timely action to save that life. Let us all take appropriate action. Timely action to save that life. Arrow is up. Pressure is up. Check the woman for preeclampsia. Arrow is down. Pressure is down. Check for bleeding. Sepsis anemia. Let us all take appropriate action.